Welcome back to Great Day Houston, everybody. All right, the pandemic has some parents wondering if they should wait before scheduling their child's wellness visit. Dr. Sandra McKay, pediatrician with UT Physicians, says no need to delay. Get the checkup today. She can rhyme too. She talked with Deborah Duncan on why visiting your child's doctor right now is so important.
Dr. McKay, the world awaits a vaccine for COVID-19, but fact of the matter is we're kind of ignoring some of those vaccines that are so important for kids right now.
Absolutely. I think a lot of families are nervous and scared to come into the office because of the situation that's going on. But in reality, they're missing out on their normal well child care. And a major part of that is preventing disease. And we have many great vaccines that prevent illnesses that we don't see anymore.
Yeah, okay, so to that point, I've had a number of moms say to me, I'm not really worried about it because I don't really see pertussis and measles and polio anymore. There's a reason for that.
So reason for that, because we vaccinate and because we're able to keep the number of people vaccinated high enough in the community that it stops the spread of disease. This is exactly what we're trying to do with COVID right now, is to create a vaccine so we can stop the spread of the disease. We have vaccines against measles, pertussis, and I've seen measles, I've seen pertussis as a physician, but it's not common and rampant because we have vaccines that can prevent that transmission.
Yeah, because it's still out there. It's not going away. But as you said, the vaccine can prevent that. All right, let's move on to the wellness visit. I think in our culture, we're kind of trained to show up at the doctor's office when we're in a crisis, and we forget about the wellness visit, the physical. What is it that you're looking for as a pediatrician that could make a whole difference between how that child's life is going to be?
Absolutely. What we do for the well child visit is that we routinely surveillance growth and development. There's a lot of changes that happen to children in their first 18 years of life, and our role is to help make sure they reach their full potential. Reaching that full potential means that they're growing like they're supposed to be growing, that they are developing on track, and if we find deficiencies in either one of those, we want to intervene right away. We want to help families when we need to. Other things that we do are screenings for mental health. We do preventative counseling. So we talk to families about drowning prevention, firearm safety, car seat safety, things that we know are common leading causes of death in children, and we want to keep our kids safe and healthy all the time. Another component is that vaccination so that we can prevent that spread of disease.
All right. For a lot of kids at a certain age, they really can't communicate with you. And I know for me, when I was much younger, I needed glasses, but I didn't know it. So you all can also check on vision, check on hearing, because a lot of times kids really can't communicate that to you.
And other things that we do is in that complete physical exam, we might find something there that they weren't really showing symptoms for. We might find a new heart murmur. We might find a mass in the stomach. We might find a swollen joint, and that the family maybe had noticed before because it just happened so slowly. Part of our job and our training is to be able to examine the child fully and treat anything that we see that's abnormal.
All right, so give us the kind of schedule of when kids should be coming in. Is it a wellness visit no matter what every year, or once a year, or are there times when you would come in more than that?
For young infants, we do see them much more frequently because, infants grow and develop so much faster. So after they're discharged from the nursery, we typically do a visit within 2 to 3 days of discharge from the nursery. We do a well child visit at 2 weeks of age, 1 month of age, 2 months of age, 4 months of age, 6 months, 9 months, 1 year. That's just the first year of life. It's a lot of visits for the families, but there's a lot of change that happens to these babies. We're screening for their development. We're making sure they're growing well. We're making sure that we're also helping the families, especially if they have any concerns for food insecurity or postpartum depression. We're doing a lot for our families.
All right, for kids who are a little bit older, we're kind of gradually easing back into sports right now. And so those sports physicals are really important too. That's why you need to have that relationship with your pediatrician.
Yes, and we do yearly checkups on kids once they hit age 3. We like to see them once a year to make sure we screen for everything. In a sports physical, we also will not only come do the regular well visit, but we also combine in that sports screening to make sure not only are they healthy and safe, but they're also safe to play any sport.
All right, your message to parents who are putting it off. We know that it is overwhelming right now for a lot of people, but what's your message to those who are putting it off?
We need to see your child. We want to help your family. We care about your children, and we want to help them be as healthy and successful as they can be. Come see us. we're probably safer than going to the grocery store.
Yeah. What components do you have in place, and what should we have in place? I mean, should we be coming in with face masks?
So if you don't have a face mask, we'll provide you with a face mask when you come in. We screen our visits on the telephone when you call in to make that appointment. If you have any symptoms of illness suggested of COVID, we'll do a telephone visit with you first and make sure that it's safe to bring you into the clinic and that we're not concerned about spreading COVID. And then what we'll also do is separate our sick visits from our well visits. So if we do have someone that we're not concerned about COVID, but maybe there's just a rash that we want to see, they're not even in the same side of our clinic as the well children that come in. We also screen your temperature when you come in, when you first enter the clinic, as well as do a questionnaire to assess for illness.
All right. Thank you so much for being with us today, and thank you for taking care of our kids.
Thank you.
All right, for more information on UT Physicians and to book an appointment, call 888-4UT-DOCS. That works out to be 888-488-3627, or visit them at utphysicians.com.